Katie from CSPI. We're just going to wait a minute to let people sign on, and then we'll get started with the call today. Hi, everyone. This is Katie from CSPI. This is the NANA Council of States call focused around fundraising. Just a couple of quick announcements. At the end of the call for the discussion portion, I am going to unmute the lines. So if you could just take a second and make sure that either your phone line is muted or the microphone on your computer is muted, then when I take you off mute at the end, we won't hear any background noise. So if you'll go ahead and do that, that would be great. I also wanted to remind people that I sent out a survey to all of you just asking about what your priority areas are for this year or which topics you'd be interested in having calls on over the year. This will just help us to determine who we should ask for speakers and which topics we should focus on. And so we're going to go ahead and get started. Today we have 3 different speakers. We're going to be hearing from Jane Wellna from the Development Department here at CSPI. You'll also hear from Jeff Usher, who is a Senior Program Officer at the Kansas Health Foundation, and from Vic Coleman, who is a fellow NANA State Council member and the Director of the Childhood Obesity Prevention Coalition in Washington State. So we have 3 really great speakers, and you'll be able to ask them questions at the end as well as give any of your own tips around fundraising or other comments that you have. If you do have any clarifying questions during the webinar, you can feel free to type those into the question box, and I can either ask those to the speaker during a break, or else I can answer them in the question box. So without further ado, I'm going to transition over to Jane Wellna.
Thanks, Katie. As Katie pointed out, I'm the Director of Development at the Center for Science in the Public Interest. And I track local, state, local, and city funding. And I'm happy to lend advice personally as needed as well to any NANA members. So starting with the first page, like page 2, I guess. Kate, you can go to the next slide. I'll touch on several funding sources listed here in no particular order, and ways to research those that best suit your needs. Fundraising is very time-consuming, so narrowing your search to just the very best prospects will save you a lot of time. So you can go to the next slide if you like. I'll start with community foundations. Community foundations are probably one of the very best bets for nutrition policy advocacy. There's a lot of community foundations that are devoting funds now to especially obesity prevention. And the map on the Council on Foundations site includes contact information for dozens and dozens of community foundations in each state. And just to point out, these slides will be made available to the participants of the call and all NAMA members. They each have hyperlinks directly to the website. So we'll be happy to send you the PowerPoint afterwards. Go to the next slide. Another resource for community foundations for finding the ones that are best for your organization is the Grantmanship Center. They have a map as well for researching local sources for support. Next slide. Conversion funds are pots of money that were made when hospitals and other health companies or health entities, public health entities, are sold to become private entities. And some 200 of them nationwide have formed since the 1970s, when the federal law was made that required that all the proceeds from the sale of nonprofit hospitals be directed towards charitable causes. And often those causes are public health and disease prevention oriented, and for populations in a very specific geographic area. So, for instance, the Missouri Foundation for Health was created in 2000 following Blue Cross Blue Shield of Missouri's conversion from nonprofit to for-profit status. So you can research conversion funds in your area by taking a look on the Grant Makers in Health website. They published a survey of health conversion funds in 2009, so it's a while ago. I'm not sure if they have a more updated one. But the report is entitled A Profile of Foundations Created from Healthcare Conversions. And there's a link to that on the PowerPoint. Next slide. For corporate sources of funding, that's of course can be a very helpful source for a small organization, especially in health department, in bringing in unrestricted funds, and also for building support for your cause in the business community. There are pluses and minuses to corporate support. Of course, restaurants and food manufacturers are eager to greenwash, or in this case, health wash their reputations. The soda industry is an example of generous grant making in a way that makes them appear to be part of the solution. Often their money goes towards physical activity solutions to obesity or schools, where they can put the logo on sports equipment and that kind of thing. And with corporate funding, nonprofits can risk compromising their reputations when accepting such gifts. However, there are many ways, there are many sources, corporate sources, which are less risky. Restaurants like Chipotle and its Cultivate Foundation are doing a lot of good work. Food manufacturers like Cabot Creamery Cheese and Bob's Red Mill are doing some really good grant making. Grocery stores like Hannaford and Wegmans and Costco are devoting a lot of funds in our area. And then there are categories of corporate funding that are really much lower risk of conflict of interest. Insurance companies like Blue Cross Blue Shield, Kaiser Permanente are doing really great funding in this field. Kitchen appliance manufacturers like Tefal, I don't know if that's how you pronounce their name, and Bemis. Gyms like the YMCA, or book publishers who do publishing around health causes like Rodale, DK Publishing, and Penguin are giving in this area. And then local businesses eager to promote the health in their community can be very useful, like pharmacies or banks, that kind of thing. So the next category is private foundations. That's also a really great source of funding for organizations. The Foundation Center is probably the very best source for doing research on private foundations in your area. They have a directory online that can be accessed for a fee, unfortunately. It's really wonderful if you're able to access it, because it's just, you know, it's got a huge amount of information available on it. However, if you don't have a subscription to that or don't have access to a subscription, the Foundation Center has 5 free libraries that offer access to their database and detailed information about the priorities of each foundation, past giving, by community foundations, corporate foundations, conversion foundations, as well as private foundations. And their database allows you to search by numerous variables and quickly narrow down your search to just the very most likely sources and save you time. So the five free libraries are in New York, Atlanta, Cleveland, San Francisco, and Washington, D.C. So if you go to their sites, you can sit down at their computers and use their services for free. I think. I haven't done it in a while, but I think that's still the case. And then government funding. Government funding, this one and the next one, the tobacco supplement funds, I don't actually know a whole lot about. Government funding, of course, is city, state health departments and CDC, national level funding from CDC or the ACA. I would guess that there are people within NANA who know more than I do. I know that Trust for America's Health tracks funding of government and, well, certainly of government funding, as does the Prevention Institute and Heart Association. So I invite members of the call to contribute what you know during the discussion portion of the call on that. The Master Settlements Fund, which is the next slide, Katie, is the money that was made available after the tobacco lawsuit. And so states have pots of money that are to be devoted originally to tobacco control, although states have control over how the money is spent. Many states have chosen to put that money towards other public health causes, including obesity. Oklahoma, for instance, is one that's done a lot of funding around obesity specifically, and some are using the funds to pay down their debt and all sorts of other ways. But if your state is one that is using funds to support public health causes, it's worth knowing about and contacting. The NIH has a listing here that I point out of how states are using the MSA funds. Next slide is about donors, cultivating your own local supporters. It's a tremendously valuable resource, either through listserv, through events, through your own board development, putting people who have resources on your board, for researching candidates. You can look at who's on the board of your local hospitals. You can do events like screening of the movie Fed Up or other kinds of movies like that to bring people into your fold and raise money in that way as well. And finally, the next slide is just another site that those people who are looking for funding related to healthy foods in school. The Center for Health and Healthcare in Schools maintains an ongoing listing of active grants and their deadlines. So you might want to take a look at that website as well. So thank you for listening, and I hope this will spark some ideas. As I said, I do track some local foundations, and I'd be happy to talk with you all one-on-one at any time. My phone number is at the end of the slide there. Thanks again. Next, you'll hear from Jeff Usher, of the Kansas Health Foundation. Jeff?
Thank you, Jane. That was good information, and it actually reminded me of a few other things that I might be able to help connect with some of your suggestions. What I want to do first is briefly give you a description of what we do here in Kansas, a kind of a history of how we've invested in funding advocacy efforts, and then tell you a little bit about some of our current work, and then I'll jump into some specific ideas around how this might help finding funding for policy efforts in your states. So first, the Kansas Health Foundation, as Jane mentioned, we are one of those conversion foundations we were formed back in 1985 when Wesley Hospital, which was a nonprofit hospital, sold to HCA, a for-profit entity, and the proceeds went to create the foundation. And our mission is to improve the health of all Kansans. So we've been around for almost 30 years. This will be our 30th anniversary this year. And we've evolved. And I think a lot of health foundations have evolved over time. And I think that's important because I think there's an evolution, especially when we think about how we really consider improving health. How I think as a health foundation here in Kansas, we've realized that the only way to really make an impact is to invest in policy systems and environmental change. And we hear that all the time. We're hearing it more and more when we go to grant makers in health. So I think there's opportunities there. So historically, we've invested in advocacy efforts since the mid 1990s. We funded and have continued to fund core operating support of tobacco-free Kansas. We felt like it was necessary to have an advocacy effort to really focus on creating smoke-free environments and tobacco prevention in Kansas. We also were real involved in funding children's health, and we thought the best way to really fund children's health in Kansas was to look at the policy opportunities in trying to increase public investment in early childhood efforts. So we've funded the Kansas Action for Children here in Kansas for a number of years, not only in doing advocacy work, but also in building their capacity to be more effective at it. So we've helped build their capacity to advocate on behalf of children in the state of Kansas. Currently, our efforts that are more related to what you all do, well, let me say this. We are at the point where most of our funding goes to looking at it from a systemic perspective. So we do very little programmatic funding. We do some, but most of our investments are in trying to impact systems in Kansas that could improve the health of Kansans. One of those efforts is what we call our Healthy Communities Initiative, which is really modeled off of the CDC Healthy Communities Initiative, where we encourage communities to develop cross-sectorial leadership teams that can influence policymakers at the local level. In our particular effort, we've asked them to focus on a policy priority around either active living or access to healthy foods. And so a number of them and we ask them to choose a policy priority. And it could be a broader policy priority. Like we have a number of them that are looking at nutrition standards in public spaces. And then we have some that are looking at publicly appointed food policy councils. So they are working at the community level, building those healthy communities teams, developing plans for that. And the plan is developing plans for this work, I think, is real important because I've seen it actually bring in additional funding for those communities in a very powerful way. And I'll come back to that later. The other investment we're currently making is in what we call our statewide partnerships. And we've funded 5 organizations in Kansas to focus on nutrition efforts in either sector-based or constituency-based statewide organizations. For instance, we fund the American Heart Association, and they're coordinating local efforts to reduce obesity through a Kansas Alliance for Wellness. And this year they are focusing on food policy councils, there's a lot of energy in Kansas around developing food policy councils. So they're focusing on educating and providing capacity building for local communities around doing that. Kansas Action for Children, again, who I've mentioned before, they're focusing on improving access to healthy food and drinking water in child care settings. On the state of Kansas, looking at policy efforts there. The Kansas Hospital Education Research Foundation, which is a supporting foundation of the Kansas Hospital Association, is a sector-based. So they're looking at improving nutrition standards in vending and food sales policies in hospitals across the state of Kansas. And then our Kansas Rural Center is a statewide agricultural advocacy organization, and they're looking at developing a series of recommendations to improve the production of and access of healthy food in Kansas. And then finally, we fund the Kansas City Healthy Kids Foundation, and they're actively working on healthy food retail policies at the local and state level in Kansas. So those are active grants that are going on right now, and that's just kind of a taste of those. So the other thing that Jane reminded me of, we also invest in community foundations. If you looked at that map that she showed, there's 32 accredited community foundations in Kansas, and we've built the capacity of community foundations primarily because we feel like at the local level, local philanthropy will understand what the needs are at the local level. So in relation to that, the other piece with community foundations and a role community foundations can do is not only, they may not have funds necessarily, but they have access to donors in the community. And they can help you understand who is passionate about different issues in the community and who you might be able to approach either in the community for supporting policy efforts. I also, one of the other areas that wasn't mentioned was hospitals they're required to have a community benefit requirements. And we have a lot of hospital systems that will also invest in those funding. And then another thing that was related to the notion of having a good plan around policy systems and environmental change is related to the government funding. Because when we first got into really investing in local community health issues, it came about because of a failure for us to be able to attract funds at the local level from CDCs or HHS, so federal dollars. And so what we've done is we've invested in local coalitions to develop plans around nutrition and active and physical activity, encouraging physical activity. And those plans, in the end, if they're ready, we've seen a lot of these communities receive additional funding to support policy efforts at the local level. For instance, Wichita received the Community Transformation Grant. We just received, several of our communities that we're working with in Kansas just received some 1422 funds that a piece of those funds will go to nutrition, helping create healthier nutrition environments in those communities. All those communities, we help build plans for their communities. So that's just another notion of building plans and how, if you're ready when funders are ready, I think that's important. And then as far as ideas around how you might engage more foundations, it's really about building relationships. So Jane mentioned the Foundation Center. I would suggest that it would be if you haven't, figure out a way to access the Foundation Center, because once you can find local funders who are funding in this area, even if they're doing programmatic work, I think it's important to begin developing a relationship with them. Because what I think I think foundations go through they get frustrated with not being able to sustain programmatic work. And I think it's easy especially if you can develop a relationship and then understand who they are providing grants to, and understanding who the recipients of those grants are, and then making the connection with what are the policy barriers for them being successful, their grantees being successful in improving the health of their populations. I think that in helping educate the foundations or the funders around the importance of investing in policy work. I mean, it really is looking at how policy can advance their programmatic work. Let's see, I have several other. The other thing is to share successes of other foundations. Once you develop a relationship, begin talking about some of the great work that many foundations across the nation are doing around access to healthy food and healthy nutrition in places. So you know, I would encourage you to learn, have them learn from other funders. I think, and as I mentioned earlier, my sense is that in the funding world, especially the more mature health foundations, they're getting it right now. I mean, I know in Kansas that we have a small group of health foundations, and all of them are making some type of investment in advocacy work here in Kansas. And then another piece of we mentioned the Foundation Center. They also developed Grantcraft and the Foundation Center developed a great document back in 2011. It's entitled "Advocacy Funding: The Philanthropy of Changing Minds." And so you can check. I just did a search. That's online. You can check that out online and share that with your funders once you've developed the relationship, so that you can encourage them to think about how they can invest in your work. With that, I'll turn it over to Vic Coleman.
Great. Thank you, Jeff. Hi, folks. Vic Coleman here from Washington State. I'm director of the statewide Childhood Obesity Prevention Coalition. So I think my angle here today is one of practitioner, specifically giving you a coalition perspective, trying to figure out how to get funding opportunities for policy advocacy, including lobbying. So as you can see here, we've got a few factoids about our coalition. Oops, we skipped ahead, sorry. We are in our 8th year. We've got 50 organizations. I'll show you that list next. We do an annual revision of our policy agenda after a very intensive process to get our first policy platform going. And as you've already heard from Jeff, that the policy and systems change ideology is something we're very strong about. And just to be clear, we are a group that does policy advocacy. We don't do a lot of program work. We were really conceived to be a coalition interested in policy advocacy. So here's our current member list, and it's public and private. I would say for our purposes today, what's really important about this list is its diversity, especially at the beginning when we really had to rely on the lobbying strength of some of our key partners. And I'll say a little bit more about that in a bit. So I just want to talk a little bit about the differences between lobbying and advocacy, get into a little bit of some of the funder differentials here around those issues. You already heard a little about that today, so might fast forward through some of that, and then some of the ways we've been working to deal with these challenges. So right at the outset, let's be clear, we need the advocacy voice of our private sector, our nonprofit sector, our citizen voice. And when we don't know what the rules are, two things can happen. We either overreach and then we get our hands slapped, or worse, or maybe even worse, we self-censor because we don't know the rules. And the latter is really problematic. I've heard still today, even having done this kind of work for going on more than 30 years, the phrase, nonprofits can't lobby. And that's exactly wrong. I'll give you some very quick rules of the road around that. But if you have a board member who's a little risk adverse and they say, well, we can't take a position or we can't lobby, boom, you're already in a problem area there. So know the rules of the road about nonprofit lobbying is, in my mind, super critical. So right out of the gate, let's be very clear about the differences between advocacy and lobbying. And here's a definition of advocacy. And political advocacy would take this a step further. But the problem is that people use these terms interchangeably. So we have to be super clear when we say advocacy or policy advocacy that those are different terms than quote-unquote lobbying. Now, lobbying is a very specific term of art. We get it defined for us by the IRS at the federal level. It gets defined by many of our states who have something like a public disclosure commission that you have to do reporting on your lobbying at the state level. And basically, it's got three components. You're trying to twist somebody's arm to influence a specific policy proposal. So you got to be talking to a decision maker. There has to be something in play, and you're trying to get them to say yay or nay. If any of those aspects or elements of the lobbying is not in place, then you are not lobbying. So one of the big take-home messages you're going to hear from me today is advocacy that stops short of lobbying is hugely impactful and powerful, and the lobbying piece of it actually is kind of narrow in terms of the amount of time you actually spend doing lobbying. So that's a big theme I hope you're going to hear from me today. So nonprofits should make this particular election. There is sort of a default setting when you become a nonprofit about what the parameters are for lobbying, and you have to proactively fill out this form here to the IRS. And the idea of this 501H test is it gives you clearer and broader parameters around lobbying. And I can boil it down for you pretty quickly here. In this next slide, oh, here we go. It's coming up. All right, so you can see here there are some ratios of your annual budget. And this might look surprising to some folks that you can lobby up to 20% of the first $500,000 of your annual budget, and then it staircases down a little bit if you have a budget that's bigger than $500,000. This, of course, presupposes you have a diversity of funding sources. So, for example, if you have only government money where you can't lobby, quote unquote, with government money, that's a clear rule, then actually these rules don't apply, because you don't have any parameters to lobby. So this looks generous on paper, but it presupposes you have to have some diversity of revenue coming in. So here's a nice little sort of compare and contrast between advocacy and lobbying. And there's the lobbying rules on the right. And the advocacy column, again, I got to make the point, doing this advocacy work is huge. If you share a model ordinance with a legislator who's interested in X issue, like procurement, like, you know, local or state rules around food and beverage standards for units of government, there are now models out there. If you just simply hand the elected official a model and say, oh, I heard you were interested in this, folks, that's not lobbying. You are simply providing information. But that can be very powerful information, because maybe that model ordinance is successful, they're interested, and boom, they're off and running. So again, major takeaway here, that advocacy column is very impactful, very important. The Alliance for Justice is one resource I just want to highlight here. They're a great resource for understanding this world about advocacy and lobbying. So there's their web link there below. So here's the second piece of what I want to chat through, the difference in funders, and I'll just make a few quick remarks here. Really, in this list, private foundations get really pretty rigid around, and again, I'm using the term here, lobbying. They might be supportive of your advocacy work, but to do lobbying work under private foundation dollars is pretty rare. Public foundations or community foundations have more latitude around this, and I think we heard Jane speak to that, so that's a better place to go to do both advocacy and maybe even a little bit of lobbying. Governmental dollars do not allow you to lobby, but and I bet many of you have this challenge. Government units are increasingly getting pushed to do policy and advocacy work, so they say, we would love for you to change policy, but of course don't lobby with our funds to do it. So that's kind of threading a needle a little bit. So you need other sources of dollars to do the lobbying part and let the governmental piece of it do the other aspects of policy development. So once again, diversity of funding sources rears its head here. And then that last bullet on discretionary funds, folks, you need to find dollars, whether it comes from public foundations, whether it comes from dues from your members, if you're in a coalition like mine, that is your safety valve money that will allow you to do the straight-up lobbying. So we pay our lobbyists $2,000 a month, year-round, so that's $24,000 a year, and I get membership donations that I solicit annually, and they know that a part of that money goes for policy advocacy generally, and part of that goes for direct lobbying. So that's how we have been able to feed our ability to have a lobbyist on staff year-round. So that discretionary fund piece does not have to be huge, but of course is super important. So just to kind of sum up here, I call this workarounds. I'm not sure that's the perfect term here, but let me just summarize quickly. So the first bullet is diversity of membership. If you're in a coalition setting like mine, initially for our first 4 years, we did a very small amount of direct lobbying. I was actually wearing that hat as well as being director. And until we got a little more robust and known, we really drafted, to use a bicycling term, off of some of our members, advocacy directors and lobbying staff. And so that might be actually a sustainable way to do it. We ended up migrating to having our own contract lobbyists, but you know, if you have strong partnerships within a coalition, maybe that works for you in a long-term way. Secondly, those precious lobbying dollars, finding donors without restrictions does not have to be a lot of money, but can give you that little bit of money that can take you over the top so you can actually do your lobbying work. And lastly, the point I've been making throughout, that advocacy voice is critical. Don't undersell that work. The lobbying piece is clearly something that you or others can do, but you can go very close to the line with good policy advocacy without lobbying by being a good advocate. So I'm going to stop there. There's my contact information, and we've got a nice chunky time here for questions. Thanks, everyone.
Thank you, everyone. So thank you to all of the speakers. I am going to go ahead and unmute you. So again, if you don't want to have background noise come through, just go ahead and mute your phone by either hitting star, or if you have a microphone on your computer, if you'd go ahead and mute that and then maybe unmute it when you want to ask your question. Or if you don't feel comfortable, you can go ahead and type your question into the question box, and I will ask that to the speaker. And I also just want to remind everyone, if you haven't filled out the NANA Council of State survey, we'd really appreciate it if you would. It will help us to determine which topics to have calls on in the upcoming year. Do we have any questions for the speakers? Or do the speakers have any comments that they want to make after hearing from the other two people?
Well, one of the things that we've done in the past, I think, is that as a foundation, is provide just core support to advocacy organizations, so we don't have to worry about them tracking whether they're doing lobbying with our investments or not. So that's one strategy that foundations, private foundations, can do to support an advocacy organization. That so they don't track core support. It's just you give them the money, and you don't ask them to report back how they spent the money, and they're safe to do that. So it goes kind of in that discretionary place that Vic talked about.
Yeah, this is Jane. That's wonderful kind of funding. We all look for that. There's no question about that. You know, I was just going to add, with respect to corporate funding, the fact that oftentimes some of the funding sources don't disclose that it's corporate funding. And Katie pointed out to me, I think it was one of our NANA members that asked her today about the Smart from the Start funding, for instance. And, you know, you do a little digging and they find out that actually who's behind it is the Healthy Weight Commitment Program, which is really the Grocery Manufacturers Association, and I think it's chaired by Indra Nui. But it's all major food companies that are interested in sending dollars to pre-K programs around the country who are wanting to do nutrition education and relay their calories in, calories out energy balance philosophy at an early age. So it's worth doing some digging when you see grant announcements. And because I saw that one specifically, the Smart from the Start, pop up on some of the grant resources pages, and it doesn't identify itself as a corporate entity. And you know, a lot of these organizations need funding, and it appears to be very quick and easy cash, but it's worth doing your homework.
Thank you for that, Jane.
Mm-hmm.
Vic Coleman here. Just want to give a shout out to Voices for Healthy Kids as a potential funder. We're getting some dollars from them right now for some safe routes to school appropriation work. And the unique, somewhat unique aspect of Voices dollars is that their direct money that I believe most, if not all, comes from Robert Wood Johnson cannot be used for lobbying, but then because of their partnership with the American Heart Association, they do have a separate amount of money for straight-up lobbying, which we've been able to tap. And it's not a big a pot as the other pot from Robert Wood Johnson, but that's fine. Again, you don't need a ton of straight-up lobbying dollars to kind of, you know, cap off the work you're doing around policy advocacy generally. So I found them to be a pretty useful donor who's pretty savvy around how to mix and match different funding sources.
You know, I'll chime in as well, because the RWJ's, Robert Wood Johnson Foundation's Rapid Response Fund is also worth noting, especially with respect to lobbying, because they come in when a policy is near passage and lend support in ways that are non-direct lobbying, but will really help your organization push it over the top, like with a poll, for instance, to demonstrate support, that kind of thing. And if anyone is ever interested in that, we're happy to talk to you about that and send you the right way.
Great, thank you, and I'd be happy to include a link to that in the follow-up email.
Another kind of idea Vic reminded me of, and it goes back to kind of educating funders, is if you know a funder is interested in, for instance, obesity prevention, and you have a convening, you might think about bringing someone in like the Alliance for Justice that can educate the funder about their role their potential role in helping fund your advocacy work.
And again, if people have any questions, they can either ask them over their phone line or through their microphone or type them into the question box, and I would be happy to ask them to the speakers. Also, if you, maybe it's not questions, but if you have tips or if you want to share some challenges that you've had with fundraising or successes, then we would welcome hearing those as well. Well, I guess it's going to be a very quiet group today. If anybody thinks of questions after the fact, then definitely feel free to email those to me and I can ask them to the speakers. And for now, again, if you would just fill out the survey, the NANA Council of State survey, so we can figure out what to have calls on in the upcoming year, then that would be great. And I will send a follow-up email with the PDF of the slides and the recording, as well as the link to the rapid response grants from Robert Wood Johnson. Thank you to all of the speakers, and thank you everybody for listening in today.
Thanks, Katie.
Thanks.
Yep, thank you.